Dr. Muliyil, I know in all our conversations you've argued that the actual number of people who may have been asymptomatically COVID positive, we don't even know. That number could be, I think the last time you said 30, 40 times higher. But the question still remains, we're looking at the language of lockdowns again. How does this make you feel in terms of the big picture?
Everything we do should have a clear objective. If you lock down and make people stay inside the houses, all 136 crores, and keep them inside the house for a month, I'm sure the cases will come down. But that will be a dumb way to do things. Now, the important thing to remember is are we in any danger? Now, when we spoke earlier, there was an anxiety. A large number of people will die. The whole nature of the COVID disease has changed. We knew there was a large number of subclinical. We also knew there was a large number of hidden cases which we don't see. But we also didn't know India was going to experience such low death rate. So that is the point of view I'm going to hold on to, because in the initial phase, when at about 96,000 cases per day, cases started falling, and there's a tantalizing fall. One of the obvious problems was that we had not reached the zero positivity we anticipated, but still the fall continued for almost 3 months. Now, what has happened to people who have been guarding themselves, being seronegative, being very COVID conscious? I think there is a relaxation which we all talk about. Now, should we panic? This is the question. Remember, whatever the reason for this is, there are some people who believe there are variants that is causing the problem. I am not sure about it. But one thing is sure, our behavior has changed in everywhere. There's less anxiety about the disease. I remember.
But now we are back to the same anxiety, Dr. Muliyil. You may be right, but now we are back to the same anxiety. We are saying states like Maharashtra, cities like Delhi impose night curfew and restrictions. I want you to elaborate on this statement that you just made. You said locking people in for, let's say, a month or a few weeks is a dumb way to do things. Can you elaborate on this? I personally think lockdowns are not sustainable. They were only meant for the health system. But we are once again getting the same reports, beds running short, vaccines running short, and that is why governments impose lockdowns. That's what they would say.
India loses almost 10 million people every year due to various illnesses and death. They need hospital care. The last year, the number of people who died of COVID alone is only about 160,000. Now, we should remember there are other pressing priorities in India. The way we view the disease is probably wrong. We keep counting virus positive. There are a whole lot of diseases where virus become positive. It doesn't touch the human being. It is not something that contaminates you for the rest of your life. Remember, natural infection also gives you very long-lasting immunity. Given that context, people infected is not a public health problem. People falling sick and dying, that is a public health problem. And if you differentiate these two factors, then they're not anxiety. What we need is, we are doing it correct. We are being cautious, but the behavior of the people, for various reasons, election, festival, they have relaxed. And what I said, I want to repeat. Most people have now learned about COVID, and youngsters know, even if you get COVID, you'll be kind of indisposed for a little while, but that is not going to make a big difference. It is the disease that affects seriously the senior citizen.
Dr. Muliyil, now you've seen the debate around vaccines, and we are still seeing the center run a very centralized, tightly controlled dispersal of vaccines. Doesn't the approach to vaccines need to change? For example, we know that there are about 6 states that account for 75% of all new cases. Why aren't we giving more vaccines to these 6 states?
Well, I suppose this kind of a dialogue should continue. But the key thing, Barkha, you said this earlier, the vaccines unfortunately don't reduce transmission significantly. It is not a bad thing. Remember that the vaccine is designed to prevent serious outcomes and death. That's the way we create the vaccine. And the mechanism of vaccine action is based on that. So if by a chance our vaccines are able to prevent transmission, that would have been a bonus. So the issue now is who are going to likely have a bad outcome. They need to be really protected first order. And again, our focus cannot be how many COVID positive. That doesn't make sense.
Exactly.
How many are in trouble. So that reduction of the seriously ill people or the people who are likely to die is best achieved by an approach that is going on now. So I think there is both parts of it: anxiety, social pressure. But very happy to hear that in Mumbai, that vaccine acceptance is climbing, which is a good sign.
Dr. Muliyil, what would you prescribe as a way forward? Because I think one of the very important things you've said, and this leads me to many arguments with friends, is that to keep on focusing on how many are positive no longer makes sense. Yet every day the dashboard tells us we have hit the highest single day spike. And what happens is we forget to tell people that most people will recover from COVID. I'm not trying to make light of this, but most people will recover from COVID. What then ends up happening is fear, paranoia, and states feeling the pressure to impose lockdowns.
Anyway, one thing we should remember, there are certain assets India has. Now remember, there was a dichotomy in thinking. You are either for herd immunity or to waiting for vaccine. Now that is a dumb way to do things. This is not, President Trump versus President Biden. Now, it is health. Both situation, natural infection and vaccine, induce exactly the same immunity, except that natural infection prevents reinfection better than infection after vaccination. So you should say, work together, infection and vaccination, both will make sure the problem ends. So if the mindset is clear, you will also figure out things in a very positive manner.
So what should the government be doing right now? And then I'll close with Dr. Joshi. What should the government be doing?
I think they should also set a little example in terms of, like, for example, use an election, no mask and things like that. I mean, this is not good because you can't have people.
Yeah, look at these shots. You can't tell people to do COVID appropriate behavior when you have all of these images, and they're all parties. It's not any one party. But go ahead. What would you advise the government to do?
No, I think we have to remember that India, the people of India, has responded so far very well to COVID with an innately low mortality. And that is the biggest strength we have. We do have a large number of people already infected, and that is in our kitty already, and they are protected. Now, all we have to do is give some finishing touches with the vaccination, and the problem is solved. So have a positive outlook, and I'm sure we can overcome this crisis.